of strength. She has been holding the fort in the economy. We want to strengthen this area because the food security and food relief is critical. Just during COVID, we were able to assist 2.8 million people in Gauteng with food relief. That department is critical to help us respond to urban poverty and hunger. It's an important department, and we are playing this player's greatest strength is in that area. We are moving ahead from economic development to social development. The third area, economic response. Gauteng is the biggest economy, not just in South Africa, but in the SADC region. We are the industrial hub of sub-Saharan Africa, the driving engine in terms of manufacturing and agro-processing. We are a critical player in Africa's economy. Thus, substantial consultations, particularly with the national officials of the ANC. I am glad to announce that Mr. Pakstau, who is currently the Deputy Minister of COGTA, will complete his work in national government and parliament this week. This is the last week before parliament adjourns. He will complete his reporting this week to parliament, and he will be sworn in next week as the new MEC for Economic Development in Gauteng. You know, Mr. Pakstau has got substantial governance experience as a citizen administrator, but he also led this portfolio of finance and economic development in the city of Johannesburg. You know, Johannesburg constitutes more than 1/3 of Gauteng's economy. So in that is this player's greatest strength includes in the area of leading the portfolio of economy, environment. He also was responsible for development planning and environment and transport in the city of Joburg before. He's got vast global experience working with global bodies. The MEC for Economic Development in a province like Gauteng requires that global experience and the global networks to attract investors into our city region. And he is also vast experience in working across the different spheres of government. So he will be, as I say, he will complete his work in national parliament, and next week the ANC will complete its administrative processes that comply with the Gauteng legislature. This is an ANC responsibility. The ANC will complete that to ensure that Mr. Pakstau is sworn in the legislature. Obviously, doing that means the ANC will be able to ensure that one of the members of the ANC is redeployed across from the legislature. That's an ANC process. The ANC is finalizing that, is doing its consultation. But the decision that we have made, firstly, as the Premier in consultation with the leadership of the ANC in Gauteng province and the leadership of the Alliance and the national officials of the ANC, is that this is a reshuffle that will strengthen the Team Gauteng's response both to COVID-19 immediately, but to the challenge of rebuilding the economy and responding to the pressures that many millions of our people are facing, especially those who don't have employment, and ensuring that we can provide proper social security and respond. So these three areas are critical. The rest of the Executive Council will remain the same. I would like to take you to the team now that's going to health, strengthening the health department's response is not just about appointing an MEC. I've briefed you previously several times that health has got deep structural and systemic problems that range over the last decade. And those problems would require a particular approach that will also help us tackle them in a systematic and sustained way. And that is for that reason that we are not just appointing the MEC for Health, we are also appointing a team of seasoned administrators and health professionals who are specialists in various areas, some in healthcare, others just in organizational management, others in finance, others are clinical specialists in that regard. So in that sense, let me specifically say that some of the areas that this team, this support and intervention team that is going to be supporting the MEC, the new MEC for Health, will also look at driving our response to COVID right now. The surge and the real possibility of a big second wave is there. Last week I spent time explaining that we need to do everything to ensure we don't lower the guard in Gauteng province. But we must be sure that the Department of Health is absolutely ready. The team, the intervention team's immediate task is to ensure we are ready. But the intervention team will also work looking at the whole organizational structure of health and look at how to strengthen our primary health care structures, how to ensure that the decentralization of responsibilities from the center to the base, how to strengthen institutional leadership of our hospitals, including decentralization and devolution of certain functions that are at head office, but also how to deal with what has been a systemic problem about financial governance, irregular practices, corruption, sustained areas where the department has been caught involved in acts of corruption, but also how to improve planning, monitoring, and evaluation of the performance of various institutions of the department, and strengthen the human resource function in the Department of Health, from the head office up to the local level. Often what we get from clinicians is that the department is top-heavy. Clinicians tell us about the gaps that are there in the system, the requisite human resource required in the cold phase of service delivery. So this team of experts in healthcare, but in management and administration, will support the department to focus on achieving this time round, turnaround. Because there's been many processes previously where turnaround has not been achieved. We have had teams and analysis of the problem. We no longer want analysis of the problem. We want to achieve a real turnaround that can be felt on the ground, particularly with regard to our primary healthcare institutions and these critical institutions that we call centers of excellence, which our province has. Improve their resourcing, improve their management, also improve their infrastructure, some of which has been done during COVID. They will help us also deal with issues related to information systems, health information systems, the district management of our healthcare system, improving district management in that regard. So I would like to share with you that the intervention team, firstly, the MEC is the key person. The new MEC, Dr. Thembi Mokgethi, is the key person. That team basically reports to him. Currently, we've got the acting HOD, HOD Malotani, who is also a key member of that team, the acting HOD of Health, but the DG in the Premier's office is a member of that team. And we've been given 3 names by the Minister of Health, because I've been saying to you that I've been talking to the National Department of Health to also help us provide 3 names. Those 3 names are of particularly health specialist Dr. Zethu Tunta, Dr. Keith Shongwe, Dr. Percy Mahlati. These are the 3 names that the Minister has given us to reinforce the Gauteng Provincial Department of Health. These names now combine them with the following additional names. In fact, just yesterday, Dr. Letitia Rispel, who used to be the head of Department of Gauteng Health, just came back to me after we've been meeting with them that she would no longer be able to take up this appointment due to she's currently a professor at Wits University, focusing on health systems. As I say, having worked on this yesterday, she came back to me to say, Premier, I have some commitment overseas. I would not be able to help you. But Roland Hunter focuses on finances. Some of you may not remember, Roland Hunter was the treasurer or head of treasury in Johannesburg at the worst of times, when Johannesburg was being turned around, when the city of Johannesburg had major institutional problems. He's a very seasoned financial administrator, public health finances. He's going to focus on finances. Ms. Seadimo Chabe, who used to be in Gauteng Department of Transport. Her area of specialty is in corporate management and human resource. Health has got significant issues pertaining to finance, as I said to you, also pertaining to HR related issues. The doctors I have referred to earlier will focus on healthcare, and that's where the next person in the team is Professor Murauzi, Professor Mperekezeni Murauzi. She is playing a key role currently at Wits University. She is one of our clinicians. She's the key leader of the clinicians in our province. She's also a member of the Premier's COVID-19 Advisory Council, but on issues pertaining to the clinical challenges faced by the Department of Health and how to support the clinical interventions that are required. She's going to focus very much on those issues. And the three doctors will also help. This department must be ready for the national health insurance. We are dealing with COVID-19 now. This is the biggest healthcare system in Southern Africa. We are dealing with COVID, but we are dealing with other pandemics. Yesterday, we were looking at the HIV and AIDS numbers. Just during COVID, the province has fallen back with regard to our performance on dealing with the HIV and AIDS epidemic. So it is also very critical, and part of the reason is because in other areas like TB treatment and the treatment of other comorbidities and access to health services outside COVID-19, we have fallen back. As we're dealing with COVID-19, the focus on COVID-19, we've fallen back on dealing with matters pertaining to HIV and AIDS. So this team will help us focus on jacking up the entire healthcare system in Gauteng province under the leadership of Dr. Nomathemba Moeketsi. So the rest of the issues pertaining to our healthcare system, we are monitoring the COVID cases very, very closely. We can say to you that we have raised this concern, but we can see on a 7 days basis, every 7 days, the number of cases reported are increasing. We've just looked at the last 7 days. We have, in our province, we have recorded over 1,800 new cases in that period. That's a matter of great concern to the province. We want to emphasize that we may not be where the Eastern Cape is and where the Western Cape is, but like it happened with the first surge, particularly as we get to the end of December and the beginning of January. This is the news we must communicate to the people of our province. That all indications are that we are going to have a significant increase, but we can do much, much better by complying with the health protocols in our province. The strengthening of the health department will also give me and the people of our province the confidence that we are not relying on a department where you have had people who have resigned because of the investigation or who are suspended. We now have additional capacity to help the acting HOD and the senior management team under the leadership of the MEC to focus on how to strengthen this department from bottom up. I want to emphasize the approach on strengthening this department must be bottom up. In the past, all interventions looked at the head office of the Department of Health without improving the functioning of these critical primary healthcare agencies. And I would also like to say that the district healthcare system is crucial. If the districts are stronger, they have strong leadership, we have invested significantly in the expertise, and we have ensured that every district has a fair share of health professionals that are required, community health care workers, and the various specialized and allied services and professionals, allied professionals in healthcare are also there at district level, and we have strong leadership. The CEOs in charge of our hospitals and the managers in charge of our district are fairly capable people. Doing that will help us a lot, not just in responding to COVID, but also in responding to the new increases in HIV and AIDS. We are deeply worried that Johannesburg and Ekurhuleni are showing new increases on HIV and AIDS. I said this on World AIDS Day yesterday. So we mustn't just look at COVID-19. Increases in HIV and AIDS are of great concern to us. And our response, so we are responding to multiple pandemics, basically. Our response to COVID must include a comprehensive response to HIV and AIDS, make sure we achieve the 90-90-90. People test, 90% of people with HIV and people know their status. And those who have tested and have tested positive, 90% of them must be on medication or on therapy, antiretroviral therapy. And those who are, 90% of those who are on therapy, we must see evidence that there's viral suppression. You can't do that if the healthcare system is weak. So this intervention of strengthening the healthcare system will help us do that. As I've said earlier on, it's not just only about health today, it's also about strengthening the other important areas of urgent priority. Every time we talk about COVID, people say to us, Premier, what about food? And then they say, what about jobs? So we are saying to them today, we have answered not just the health, the COVID issue, we are also answering their question about enhancing our response to protect the most vulnerable by putting players to their greatest area of strength and enhancing our economic reconstruction and recovery. Gauteng needs to be the leader in the reconstruction and recovery of our country's economy. That plan implemented by President Ramaphosa. We must be in the forefront of leading this and ensure that every sector of our province can see that we are really, really dealing with these issues. COVID was quite severe in its impact. It had multiple impacts, but these three areas are critical. We are satisfied that the law enforcement and compliance leg is doing well. Mobilization of the grassroots is doing well. Mobilization of local government in that area, we are doing well, but we want to improve our overall response in this area so that we can build Gauteng together. So that's really the long and short of our briefing today. So the Provincial Secretary of the ANC is leading the processes of the ANC to ensure that we will have Mr. Pakstau in the legislature as a member, sworn in as an MEC for economic development, and agriculture in Gauteng province next week. Thank you very much, Thabo. I think I covered, you remember these guys always prepare very long, detailed stuff. Today I cut to the chase. They like me to say all kind of things. Para like me to say all kind of things, Thabo. I cut to chase. You will get that. We are strengthening healthcare, we are strengthening our economic response, we are strengthening our response to improve social relief and food security. We are ready for questions.
Thank you, Premier. We will now take questions. Can we have the mics moving around? And as you know, I'll ask you to just introduce yourself.
Premier, it's Ndaedzo from Power FM. Just two quick ones for me. Why did it take so long for you to appoint the MEC of Health? I mean, to me, it looks like it was pretty much straightforward. You could have just shifted the MEC of Social Development to Health, and it would have been a done deal. And the second one, I've just seen a report showing that the National Coronavirus Command Council has recommended some strict measures in hotspots. I know Gauteng, so far we are not yet, or we are not a hotspot, but would you agree to stringent measures going into the festive season that would be implemented in hotspot areas, considering that you are the economic hub of the country and it might have some form of economic impact should it be applied across the board, these restrictions? Thanks.
Okay, thank you. Yeah.
Hi there, it's Yanda Noble from Newsroom Africa. It's sort of linked to my colleague's question, but the last time, Premier, we were here, you said that you're asking the health entities to step aside pending the completion of that SIU report, which we know hasn't been completed. So if you could just clarify for us, what exactly changed, Premier, for you to now actually, reshuffle your cabinet? And was your hand forced in this regard regarding the change within your own cabinet? And then the second question I have is related to the News 24 article on the NCCC's meeting yesterday to extend the curfew. I'd just like actually specifics of where the hotspots in Gauteng are and whether or not you would also then be agreeable to actually implementing a curfew earlier in these particular hotspots and also curbing the sale of alcohol in these particular hotspots during the festive season. Thank you.
Okay, are there other questions? All right.
Good day, Lisa Gatano from News 24. Premier, I just wanted to ask you three questions. One is on speculation that you had asked the President to release Dr. Ramaphosa to come into your cabinet. I want to find out if that is true or not, and if you did ask the President, what was the engagement like? The second question is around, also yesterday, last night, we heard a lot of rumor about, well, the ANC Youth League even released a statement about you as well as the PEC wanting to purge their own in order to recycle the elders, as they call them. I wasn't here earlier, but could you share if who exactly resigned in order or had to step down from as an MPL in order to ensure that Mr. Parks Tau returns? And also in terms of the NCC report that News 24 just published, given that we don't have an accurate understanding of whether there are hotspots here in Gauteng, and there's been allegations that you have inaccuracies in your numbers in terms of COVID-19 during the past couple of months. Can you concede that you've had a problem there, a challenge there in collating your numbers in terms of your regions and your districts? Thank you so much.
Slida Lomasigan from ENCA. I'm covered by most of my colleagues. But just for clarity, Premier, what swayed you, what changed your mind in terms of bringing Parkstyle in? Because we did see that media release from the ANC Youth League. And just to add on to my colleague's question as to who actually had to step aside for Parkstyle to come in.
Okay, I thought, yeah, that's fine. The Premier will ask. Oh, let me just check. There are a few that I got here on WhatsApp. The Premier last week expressed concerns. I don't see the person who sent this here. Is it from Mark Haywood? News 24. The Premier last week expressed concerns of a possible increase of cases when people come back from December. Is there are there any practical plans to deal with this? And the second question from News 24 again, what is the plan to boost the economy during the festive season? But also bearing in mind that COVID-19 remains. And then, okay, it's from Luandi Lebengu. And the other question, this one I suppose is from Mark Haywood. The Premier promised there would be a civil society member, but there doesn't seem to be anyone. Okay, yeah, that's Mark Haywood from Daily Maverick. Those are the questions, Premier. I see that a lot of questions are about the NCCC, which the President obviously speaks about the NCCC, but the Premier is now asked to speak about the NCCC. I'm not even sure if there's been a meeting of the NCCC. But the Premier will be able to deal with the issues, including what he had explained earlier, that there are processes which are being dealt with by the ANC. But I see the colleague who asked that she was not here when we said that.
Let me start with the last question, especially the question on civil society. Mark, we are definitely committed to having a civil society representative who will add a great deal of value to the work of the intervention and support team. We call this an intervention and support team because it is not a takeover of the department through Section 139 or Section 100. It is a team to help the MEC for Health to achieve a turnaround, but also to bring along those very committed professionals in our healthcare services who are not involved in malfeasance, who are not involved in corruption, but who often have to endure when there is a problem that takes place because things were not done properly in that area. So we would like those to be brought along. So Mark, we will definitely have a civil society representative. I had said earlier on that Professor Letitia Rispel had just indicated also that she is taking up another task elsewhere. So she came back to me after expressing a lot of support for this process to say, I'm sorry, Premier, I have to take up another task somewhere else. So we will replace her with another healthcare professional with a great deal of experience and depth, but we'll also have a representative of civil society. Civil society is important because the feedback we got yesterday on HIV and AIDS, the impact of COVID-19 on people living with HIV and AIDS, we got that from civil society. Yes, there's research done by Tembisa, the research that was done, but the best feedback I got on World AIDS Day was from organizations representing people living with AIDS on how during COVID, the services provided to people living with AIDS were not up to scratch, and there were difficulties during the lockdown. So we do need the way we organize our healthcare services must, yes, indeed be responsive also to those civil society organizations that are active in the healthcare sector. And we want to walk this journey together, Mark. So the commitment is still here. It is something we will finalize now with the new MEC for Health. We'll finalize this. Any plans to boost the economy? Not just during the festive season. I was explaining in detail that the decision to bring Mr. Pakstow, Comrade Pakstow, into the provincial government is to also help strengthen that area of work and bring his strength fully to bear. We have announced our plans on economic reconstruction and recovery. We have announced them here, focusing principally on how do we get the special economic zones in Gauteng province, which are the real lever, the principal lever of our economic transformation, modernization, and reindustrialization agenda in Gauteng, the special economic zones. The industrial parks and the agro-processing hubs in the 5 different districts and metros in Gauteng. The plans are there. The Township Economic Development Bill about how we support the township economy. The plan is there. We are already rolling out the Tshwane Special Economic Zone. It's an important area of work. We've been working with the MEC Murakani Musupi feverishly to get that going. The work on the Vaal Special Economic Zone, but supporting small businesses is the most critical. Many small businesses suffered severely, closed down, are on their knees basically. You know, we set aside 250 million rands to support small businesses. I expressed, last week, I expressed unhappiness with the fact that that money has not yet been dispersed to small businesses. That's going to be one of the critical urgent tasks of Mr. Pakstow when he takes office in December now, because we are in December. Any plans, News 24, any plans to deal with COVID, the COVID surge? Essentially what I've explained to you, this team, the intervention team, will be undergirded by a response plan. That response plan has come to the Provincial Command Council. It has served before the Provincial Command Council. It has been improved. Our advisory council has made lots of inputs on what we need to do in strengthening our response to the surge. Now in December and later when people return from the festive season, I have a meeting with the new MEC for Health and the team from the Department of Health this afternoon. Immediately we finish here. These meetings have been taking place to improve what they have put on the table. But we are guided by the Premier's Advisory Council on COVID-19. They have made lots of inputs. These interventions to strengthen the team to ensure that there is no vacancy. And this answers the question that 2 of you have asked. Premier, why now? I am deeply concerned. I want to repeat what I said last week. I'm deeply concerned about the fact that Gauteng province may be where we were in June, July, by January this year. And the numbers are not yet overwhelming, but the indications are there. In the Gauteng legislature, I have received strong indications from all the political parties in the legislature, from my party, the governing party, the ANC, that everything needs to be done now to strengthen the Department of Health. Why has it taken long, Daezo? And I want to make this point again. When this decision was made, it was clear that this point was made in the ANC and to the different structures, the alliance, that the health department is not only having a problem at the top, it is deep, systemic, and structural. I received a report from the Public Service Commissioner, Mike Seloane. That is after I had made the decision to discharge MEC, then MEC Dr. Bandile Masuku. I received a very comprehensive report from the Public Service Commissioner, Mike Seloane, who said, Premier, you need a deeper intervention. These are the areas of problems in the Department of Health. And I'm saying, that report has also informed why we must intervene the way we intervene. But the surge is also informing me on how I must respond. As you know, MEC Bandile Masuku is taking the SIU to court. You don't know court processes. I'm sure you are not suggesting that I must wait for court processes. There's a protracted process, the ongoing SIU investigations, the court processes now. I cannot risk strengthening the Department of Health and Gauteng response by getting bogged down on those processes. And so I was informed by the surge the evidence of the surge is here. Secondly, I was informed also by a report from the Public Service Commission that says we need deeper interventions in the Department of Health. Just bringing in an MEC there will not solve the totality of the problem. But I'm also informed of the process that now there are protected other processes that have. The courts operate in this country as the courts. I operate in the realm of executive decision making. There's a separation of powers. I must take decisions in the best interest of the people of our province. What we are facing now requires a stronger health department, including political leadership. And in the period between now and December 31st, a lot of work is going to be done by the new MEC for Health, together with the team, the intervention team, and the department, the leadership, under the acting HOD, to have to ensure that Gauteng province has learned from the June-July surge, has better capacity and is better prepared for January, especially for January, because a lot of people are going to move out of the province now. They are coming back in January. Let me say to you, when you come back in January, we will do what we normally do when people are returning to the province. We are going to conduct health-related operations together with law enforcement operations to ensure that we do screening, testing on the roads, the major roads. Already our law enforcement agencies are returning to the major exit routes out of Gauteng and the major entry routes into Gauteng. So part of this preparing for the surge, I have a meeting with law enforcement agencies tomorrow, just for them to present a plan to me to say, Premier, for the holidays, law enforcement is ready, but also related to the surge, because if you may understand that part of where why the surge happens and infections increase is increased level of mobility and activity in certain areas where there's no compliance. So we are also stepping up law enforcement operations, including compliance, As much as we are stepping up and strengthening the health measures and strengthening the response to the families, households, and individuals who need support in the area of food security and social relief. We are stepping up in all those areas. And economic response. I want to say that as it pertains to the issue of the Youth League, I would refer you to the Secretary of the ANC, Comrade Jacob Kawe, deals on behalf of the ANC on ANC matters. I'm on a government platform. I don't want to talk about internal organizational matters of the ANC. I am very satisfied that the decisions we have made, the provincial office bearers of the ANC are empowered by the ANC National Conference resolution to make decisions, and the Premier makes the decisions empowered by the Constitution of our Republic in consultation with the party. But in this particular case, also the alliance. It's a tradition in this province that when we make decisions, I've been Premier for 6 years now, and it has happened even before with my predecessors. The office bearers would consult with the alliance and the national leadership of the ANC who have given us full support on these measures. So I think the issues raised by the Youth League will be dealt with by the ANC Provincial Secretary. But I want to say to you, in this cabinet, the representation of young people is stronger than it has ever been before in any other provincial cabinet in Gauteng. The representation of young people in the Gauteng Executive Council is stronger than it has ever been before. Previous cabinets had either one young person. Most of the time it was mainly one young person from term to term, and in other times there would not even be a young person. I am very satisfied, and the young people and the younger ones. Others are growing old. They are no longer young people, but they are still younger. They are shaping up, and I am satisfied. And the ANC will speak for itself with regard to that matter. There's the question about. I am certain that we will have Mr. Pakstau, and in an ANC sense, Comrade Pakstau will be sworn in our legislature soon, because the ANC knows how to handle these matters. We've done that before, how to handle matters to ensure that one of the ANC members will be redeployed to where they can play with their strength. That's what the ANC is dealing with. All I can emphasize is that we will have the current Deputy Minister joining the Gauteng Provincial Cabinet to strengthen the work we are doing. I must remind you, is the treasurer, the provincial treasurer of the ANC. He sits in what you call the top 5. The top 5 in the province and the top 6 nationally. He sits in the top 5 of the province. So he's a senior leader of the ANC in this province. And all the principles are covered in the current Executive Council. So that is not a problem for me. That we will through the Provincial Secretary of the ANC, we will be able to let you know when Mr. Pakstau will be sworn in. It will be soon, it will be next week, because he's completing his work in national government and parliament this week. There's one or two questions. Yes, let me tell you the issue. Those of you who have always gone through our reports would know that there was always a variance between the district numbers and the province-wide numbers. There was always a variance, and we were very transparent about that variance. When we get the new infections, we get the numbers, the sources are from both the private sector and the public sector. It takes us time to reconcile. We know what the global figures are. We know where the largest numbers are coming. There's always a reconciliation district by district that we always have to do. And when the variance is big, we ourselves have sent the Department of Health team back many times to say, clean up your data. We have done that previously. And when the infections begin to increase, we want to be sure we don't just record that the infections have increased, but we record where are they coming from, which district is the driver. And to do that, we do lots of verification. So the cleaning up of data, we have a data team in the Department of Health that is responsible for doing that. Every time there are questions on data, we send them back, go and do that. And this work about ensuring that our data is impeccable, is absolutely reliable, is ongoing work that we have been doing. But I can tell you at the moment that the numbers are stable. The global figures of Gauteng are not questionable, the number of infections. So when you have to get to the districts, you've got to be accurate that this district is the driver of new infections. Because if you are not sure, you are going to deploy resources to an area and miss the one that's actually the driver of new infections. That's why accurate data is important. But the exact numbers, in Gauteng we don't have the surge. I said to you that we are concerned that we will, as we get to the end of December and as we get to January, we're likely to experience the surge. Our numbers, Dr. Mary Kaunga last week said our numbers are stable. There are increases, there are new cases, but on a daily basis, though, that's a stable between 5 and 6% increase. These numbers will change, and the more mobility and the more travel that takes place and the more activities, partying, the more people go to shopping malls, the more people gather, do family gatherings without the masks, without social distancing, these numbers will increase. So we do know at the moment what we call stable. These numbers are stable across the different districts. But we are preparing for the West. We know last time the key driver of new infections became the West Rand, and then it's a certain part of Johannesburg, and then followed by a certain part of Ekurhuleni, and certain parts of Tshwane came back later, the northern areas of Tshwane, as we were dealing with the West Rand, and then last came Sedibeng. The infections then came in larger numbers, including increases in admissions, hospital admissions, and in deaths. Because you know, if you want to see if your information is reliable, you mustn't only monitor one variable. You must look at what's happening to infections, new infections, what's happening to hospitalizations, and then you must look at what is happening to the number of people who succumb. The COVID-19 Command Council looks at that. When they see that one area there's a big increase, they go back and say, no, we are concerned that these numbers may not be accurate. If we are getting too many people admitted in hospitals, because this is monitored on our dashboard on a daily basis, and yet the numbers are saying we are stable, we can't be stable and get sharp increases in hospital admit. It means we are missing something, so that we do that. So that is absolutely important to focus on that. The Gauteng hotspots would largely, we are continuing to deploy, mobilize teams, deploy our teams, particularly to the townships, to the areas of transport modes, where there are going to be a lot of people moving in and out of Gauteng. The transport nodes in our province are an area of focus, and the suburban areas, in the first wave, they drove infections up to a certain point, especially when you are going to have travel, especially when travel is also open for flights you know that there may be infections coming through our port of entry called OR Tambo. Now that it is open, it is a key area of focus for us. The suburbs increases are always linked to open travel, to open international travel. Once you open international travel, the people who travel a lot through that means are people who are well off, and that's why you would have to monitor what's happening in the suburbs once you open the international travel. So we are focusing. We have learned important lessons in the first phase of the outbreak, and that first phase for us include up to the end of August. So between mid-March and the end of August, we have learned important lessons, and those lessons are internalized and integrated in our response, including the infrastructure capabilities, how to ensure that all our healthcare workers have adequate PPE that is procured properly, not in the way it was done before, but also how to take action where things have gone wrong, either on PPE or infrastructure refurbishment. We want to be consistent on the same basis. And where was my hand forced? You know, forcing someone's hand can be a crime. You know, if you force someone's hand, it's almost, you can be charged of harassment. So I wasn't harassed, really. The interventions we are making, including the need to act now. I've given you the reasons. The need to act now. The surge is around the corner. And there are other processes that are not under my control about how they would, when would they would. Those processes that have to do with the MEC challenging the Special Investigation Unit report are processes of court. They are not under my control. What is under my control is to make decisions that say, how do you respond to the need to structurally and systemically improve the healthcare system in Gauteng with immediate effect? And how do you strengthen your response to what may be a real big situation in January? So for that, you can't do half measures and just say that you have acting people to do that. And in fact, I've been asked by you before, when are you appointing, and the media was asking, when are you appointing the MEC? Now I have appointed the MEC. You're asking me, why did it take you so long? Or why don't you wait? You are doing your job, you know. I understand that you are doing your job, but I am doing mine too. I am doing my job to ensure the province is in a good shape to can handle the surge, handle the problems that are emerging in the HIV and AIDS pandemic space as well, raised quite sharply with us yesterday. Now, there are several questions asked by you in the media about the NCC, the NCCC. The reason I couldn't attend the NCCC this morning is because I was preparing for to appoint the MECs. I was meeting with them this morning to brief them on their new responsibilities, then the rationale, the two MECs and the Deputy Minister of COGTA, who will assume this responsibility next week. I needed to do that in the morning, but I do know what was decided there because I sent the DG and the MEC for COGTA, but it is not our responsibility to communicate the decisions of the National Coronavirus Command Council. It is not our responsibility. It is the President's responsibility. Sometimes he may decide to delegate to ministers. The provincial government is ready to deal with the surge, and that's what I'm demonstrating here is a readiness and a preparation. Are we willing to strengthen in other measures? But let me tell you that at the moment in Gauteng province, there is no case to have measures like the lockdown. We all know lockdowns can have a big impact. You have to really weigh things very well. We are not there. The numbers don't indicate that there is a need for that. But you must also understand that when your focus is on, I said to you, the recovery and the reconstruction of the economy is one thing that people in our communities are raising all the time. We hear you about COVID. Yes, we want to comply with health protocols, but what is happening with regard to the economy? So I think we shouldn't be put in a situation where we choose between health and the economy. And I'm confident that the National Coronavirus Command Council will take the interest of the people of our country into account, but they will also look at the trend in each area. I can't say to you that should we have the big surge in January or in February, I can't say to you what we are going to do then. I think what we must do is to appeal to the people of our province. Let's put on our mask. Let's sanitize. Let's maintain social distancing, even in the midst of the festive season. It's difficult. There are those of you who are traveling emakhaya. But even there, just carry this message with. Whichever way you travel, let's just demonstrate that we are all deeply concerned. And we want the economy to remain open. And the way to ensure the economy remains open is just to ensure the infection levels remain so low. And we contain the spread so that we are in that situation. So wait to hear from the President about the NCC. But I have already said to you, we are increasing law enforcement visibility. In January, we are going to be doing the roadblocks that also help us ensure that we can do tests on this, screening and testing on the sites. And as we did earlier this year, when we moved to the level of reopening, we were able to get on our roadblocks a lot of people who were immediately moved under care of our health professionals. Those who showed signs were moved immediately under care of health professionals. So we will do those things, but and the stricter health measures also include health protocols, include just ensuring that in public spaces, in business spaces, we want the issue of the wearing of the masks and sanitizing hands to be maintained. It must be enforced. In the churches, it must be maintained. It must be enforced. In the supermarkets, it must be maintained. It must be enforced. In public spaces, it must also be enforced. Social distancing must also be enforced. The rest are the issues that can only be dealt with by the President because he's got the authority to do so. We can deal with the issues that are within our power to do so. So those are the specific issues. If you want to ask a question to the ANC Provincial Secretary, if you don't have his number, I will help you to give you his number so that he can deal with ANC-related issues. But that is the briefing for today. Thank you so much. Thank you so much for coming. So you are discharged from the command center. You are discharged for festive season. Well, I don't want your big chiefs to fight with you. Let's take a holiday break properly. But thank you so much. has a big task for him. How can I go to the president and say, President, release him? He was in the province. But I'm very happy that the president understood why I need Mr. Paxton. Dr. Ramokgopa is busy on infrastructure. You know why? That infrastructure development is a key part of our recovery and reconstruction plan in Gauteng. And in fact, he is helping not just Gauteng, all the provinces a lot to drive a sustainable infrastructure program. So there's no way I would go and ask the president after he was released in Gauteng. That's why I forgot. So far-fetched.
I want to know how long will the intervention?
They're on my intro.
How long is it?
Well, can I just talk to you? So that we don't do another.